Assalamu alaikum, this is Dr. Hasna with Hasna's Anatomy, and first of all, today I'd like to thank each one of you for showing me so much love on my channel, for subscribing to me. So let's get started with the topic of today, which is the front of thigh. And in the front of thigh today, we'll be studying the femoral triangle, the canal, the sheath, the femoral ring, and finally, an important clinical, the femoral hernia. So let's get right into it. First of all, it is very important for all of you to know that this is your thigh, the front of it or the anterior side of it. This is divided into an upper 1/3, a middle 1/3, and a lower 1/3, after which your knee will begin. The upper limit of your lower limb is marked by the very important ligament known as the inguinal ligament that we've talked about multiple times before. This was the ligament that ran from the anterior superior iliac spine to your pubic tubercle, and it is forming the upper limit of your lower limb where the lower limb begins. So what is the femoral triangle? Let's get started with the femoral triangle first. Now the femoral triangle is a triangular depression located in the upper 1/3 of the thigh, immediately below the inguinal ligament. So you can see this is your femoral triangle. As you can see, it is occupying upper 1/3 of your thigh, and it is basically its base is formed by the inguinal ligament. The other boundaries of this triangle include the apex, where the medial and lateral boundaries will join. The medial boundary is formed by obviously the medial compartment of your thigh's muscles, which are the adductors. The one that is forming the medial boundary of your femoral triangle is known as the adductor longus. The medial border of the adductor longus forms the medial boundary of your femoral triangle. The lateral boundary of your femoral triangle is formed by the sartorius muscle. If you remember, it originated from the anterior superior iliac spine and went on below. So the sartorius is the lateral boundary of this triangle. The adductor longus is the medial boundary of this triangle. The base is formed by the inguinal ligament, and the apex is where these two boundaries cross. The roof of the triangle is formed by the skin, the superficial fascia that carries the contents of the superficial fascia that we discussed in the earlier videos, like the inguinal lymph nodes, genitofemoral nerve, ilioinguinal nerve, etc. And then the deep fascia. The floor of the triangle is formed by the adductor longus and the pectineus medially, and laterally the floor is formed by two important muscles, the iliacus and the psoas. So this was basically the boundaries of the femoral triangle. Now let's talk about the contents of femoral triangle. What is exactly lies in the femoral triangle? So I'm going to draw a femoral triangle over here again. All right. There are very important contents in the femoral triangle, including your femoral artery, which is the middlemost content of your triangle. It crosses from the base to the apex of the triangle with its 3 superficial and 3 deep branches. So femoral artery is your major content with its branches. Apart from the femoral artery, on the lateral side of the femoral artery lies the femoral nerve, and medial to the femoral artery lies the femoral vein. So you can see that the arrangement of structures from medial to lateral side is VAN, vein, artery, nerve. And finally, other contents include the femoral sheath that we'll discuss in a while. The femoral sheath, and then the lateral cutaneous nerve of the thigh, the femoral branch of the genitofemoral nerve, the deep inguinal lymph nodes, and the nerve to pectineus. Now I'm sure you're curious as to what is the femoral sheath that was making the content of your femoral triangle. Well, the femoral sheath is a sleeve-like fascia that is covering your upper 4 centimeter of the femoral vessels. All right. That means if this is the femoral artery and this is the femoral vein lying medial to it, this fascia is going to be covering the upper 4 centimeter of these vessels. All right. This femoral sheath is funnel shaped. So you can see that its lateral border is straight while its medial border is a little bit oblique, and it is covering upper 4 centimeter of the femoral artery and the femoral vein. So this way it is forming 3 compartments. As you can see, this is the lateral most compartment. This vein is forming the intermediate compartment, and finally there is the most medial compartment of this femoral sheath, and this most medial compartment is known as the femoral canal. Here comes an important term again. So everything is interlinked. Before we talk about the femoral canal, let's talk about the femoral sheath. So the upper 4 centimeter of the femoral vessels are basically covered by a sleeve-like funnel-shaped fascia that is anteriorly being formed by the fascia transversalis, and posteriorly the fascia is formed by the fascia iliaca. So you can see that the sheath basically comes from the abdomen, and beneath the inguinal ligament it passes this way and covers your upper 4 centimeters of the vessel. So this fascia has 3 compartments: the most lateral compartment or the arterial compartment, which consists of the femoral artery and a small nerve that is passing with the artery known as the femoral branch of genitofemoral nerve. The intermediate compartment of the femoral sheath consists of the femoral vein, and finally the most medial compartment of the femoral sheath is known as the femoral canal, and it carries the content of a single lymph node known as the lymph node of Cloquet or the lymph node of Rosenmuller. This is lying in the femoral canal, which is the most medial compartment of your femoral sheath. Now let's shift our focus into the femoral canal. So the femoral canal, as you all know, is, let's say, triangular. It has a base above and an apex below. The femoral canal above, as you all know, if we come back to the bigger picture, this is the femoral triangle, this is the femoral sheath, most medial compartment, this is your femoral canal, and the base of the femoral canal, or the most upper border of the femoral canal, this area right here, is known as the femoral ring. So it is going to be the femoral ring lying just behind the inguinal ligament. So it's going to be a ring like that. The femoral ring is going to be formed anteriorly by the inguinal ligament, of course. Posteriorly, it is going to be formed by the pectineus muscle. As you can see, the pectineus was lying here. Medially, the ring consists of the lacunar ligament, and laterally it is obviously going to be containing fascia separating this ring from the femoral vein. Alright, so that is your femoral ring. So this was an overview of all the types of femoral anatomy in your front of the thigh. So once again, we have the largest part, the femoral triangle. You zoom into the femoral triangle, you see the femoral sheath. When you zoom into the femoral sheath, on the medial compartment of the sheath, you see the femoral canal. Zoom in even more into the femoral canal, and the base of the femoral canal is known as the femoral ring. So these were the important parts of the front of thigh. And finally, it is necessary for all of you to know that the femoral triangle overall, the apex of the femoral triangle, is continuous with another canal in the medial compartment or in the middle third of your thigh known as the adductors canal, which we will soon talk about in the next video. So that was all that you needed to know about the femoral triangle canal sheath. Now let's talk about the femoral hernia.